Hi everyone, I'm Senator Alex Padilla. And I want to begin by thanking the California Perinatal Wellness Alliance, along with all the partners who helped bring this convening together. I want to recognize the parents, the providers, advocates, survivors, and community leaders in the room working to support so many families across California and helping move this important conversation forward. Perinatal mental health conditions are among the most common complications associated with pregnancy and childbirth. Nationally, about 1 in 5 mothers and 1 in 10 fathers experience a mental health condition during or after pregnancy, yet far too few receive the care and the support that they need. Left untreated, these conditions not only saddle mothers and fathers and their families with incredibly heavy burdens, they cost our country an estimated $14 billion in health care, lost productivity, and long-term impacts on families. But we also know that these challenges don't exist in isolation. Families today are navigating rising costs on basic goods like groceries, gas, and housing. They're confronting enormous economic uncertainty, with so many struggling to find and maintain stable employment. And for many immigrant families, an added layer of very real fear and instability. These pressures take a real toll on mental health, especially during pregnancy and soon after a child is born. As a husband and father of 3, I know how magical and wonderful that period can be as you get to know your newborn child, imagining all the possibilities that lay before them and wondering who they will eventually grow up to be. But I know it can also be one of the most stressful times in a parent's life as you adjust to an entirely new reality. That's why I've worked hard to advance efforts at the federal level to improve maternal health outcomes, expand access to care, and address disparities, especially for minority communities that too often get left behind or overlooked, with legislation like the Kira Johnson Act. But even with efforts like the Kira Johnson Act and the creation of the Senate Bipartisan Mental Health Caucus, the fact is we still don't talk enough about mental health in America generally, and especially perinatal mental health. That's why this convening is so important. By sharing your stories, bringing attention to those issues, building community, and turning lived experience into action, you're truly transforming pain not just into power, but into much needed change. So thank you again for your leadership. Thank you for gathering together today. And thank you for your ongoing partnership in this critical work.